Assalamualaikum warahmatullahi wabarakatuh and greetings everyone. So today in this video I'm going to talk about um, the effectiveness of social media in health communication to educate the public about health and medic. So in this issue, I'm strongly agree about the effectiveness of health communication via social media to educate the public. This is because that technology had evolved from time to time for people to share about informations towards the public as it has more audience and it is free, cost saving and time saving. So let's move on to the reasons why do I agree with this. So firstly, we're going to talk about most people spend more time on social media to gain new knowledge through online articles being shared widely on social media. So this is because that from the study states that Malaysians averagely spend 8 hours and 5 minutes online and less, and has an 80% internet penetration rate. So as you can see here from the study given from the statistics that most Malaysians spend more time on the social media, and from the experience for myself, I do spend more time on social media to read on articles about health, about education, instead of going to library and reading books or articles. This is because that I think that social media have the latest information about something rather than in library, because most library they have the old information about something, so it doesn't really update from time to time. And another reason that it does save time for me rather than going to library and searching for the books and then to search for the things that I want. But through social media, it is more convenient for me to actually know about something, to get a knowledge about something. So move on to the next point. Furthermore, it is more convenient to do health communication via social media as we can insert statistics and graphics as additional reference about the topic. This is because, as you can see, some Malaysian specialists, doctors such as Dr. Benny Ruzani, a cardiologist in IJN, and also Dr. Hafiz Sazwan, a specialist in veterinary medicine, had utilized the social media mainly on Twitter to create a lot of threads about medic which consists of facts and graphics. So I would personally think that for them it is easier for them to convey and to share information about something to share about health information in their own specialties through social medias, because they can actually insert the graphics or statistics to show the audience on what they are trying to share about the things that they are going to talk about, and they would prefer using social media as it can get lots of audience, and it does really helpful for the people to get the knowledge about their special to get the knowledge about to get the knowledge about medics in their own specialties through Twitter. And as you can see, there are more Malaysian doctors that use Twitter as a medium um, for them to share the information about their specialties. So I would say that for them, it is convenient for them to share their knowledge through social media rather than talking individually from one to one to an to for with their patients. I would personally say that it is better for the patient to meet them individually if the case is quite serious and they need a consultant from the doctor. As for a general knowledge about their own specialties, they can go through the social media and go to the Twitter of Dr. Benny Ruzani and Dr. Hafiz Sazwan or any other doctors to get the general knowledge about the information about the medic. So the last point would be, lastly, health communication via social media saves a lot of time and cost in sharing information about medic. This is because that sharing information on social media is free, doesn't cost any money, doesn't require any cost for papers, for them to do books, or maybe for them to do the journal. It doesn't require any cost, and also it saves time for everyone to learn to learn about the medic, rather than the doctors making a seminar about it, which is quite expensive actually for an entry. And also the number of audience that can join the seminar is quite limited. While for social media, we can have thousands or even millions for them to actually read the thread about the medic, which is quite better. It's way much better than making a seminar, because if you're talking about a seminar, we actually need to book a room, and I would say that a room which may cost a lot, and also the audience is very, very limited. I think it's limited to around 1,000 or maybe less than that. But in social media, in Twitter, as you can see, when the thing goes viral, the whole Malaysia can actually read about the threat about the medic from the doctor itself. So I think that obviously shows that social media saves a lot of cost, and also saves time for the others, for everyone actually, for all. So in the conclusion, we have looked at why does health communication via social media is effective, which includes the amount of time people spend on social media, and health communication via social media is more convenient, and also it saves a lot of time and cost. So hence, members of medical officers should utilize social media more frequently in sharing information about medic in their own specialties towards the public, to educate the public more and more about health and medic. As an example, if you go through Twitter, you can go to the hashtag #MedTweetMy, which it consists of a lot of information about medic that came from the specialists from the whole Malaysia. They even have their own Twitter for that, to share information about medic towards the netizens, which I think it's very good for them to do that, as they share information for free, and also to help people to get to know more about medic. And I would say that they can actually present more latest issues about the medic, and also share more information about medic in their own specialties. They have their own organization of the #MedTweetMy. So I think it's very good idea. So that's all for the video, and thank you for watching.